Ready? Hi, today I'd like to share another case study on hyperemesis. Now, this patient has a particularly rare and uncommon symptom that we actually don't really observe very much in patients who develop hyperemesis. We know that hyperemesis has its distinct symptoms. No matter how rare it is, we will always see the patient experiencing severe nausea, severe vomiting, insomnia, and also excessive salivation. And these are some of the symptoms that we observe that can help us actually diagnose this very rare but deadly pregnancy's sickness. So we do know that the core reason is that these M1 receptors, these muscarinic acetylcholine receptors that are found distributed all over the body in very important glands, muscles, in the digestive system, in your reproductive system, in your central nervous system, even in the brain and your oral cavity. These receptors are found in the nerve endings of the parasympathetic nervous system and also the sympathetic nervous system. So they are found abundant in the the system of the human body. So the core reason behind hyperemesis is that these M1 receptors are being triggered non-stop. It's a hypersensitization reaction that occurs in the body, which is why we see all these symptoms that are associated with the M1's receptors function. So excessive salivation, because there's M1 receptor in your mucous glands that are triggering the secretion of this saliva, and then there's also M1 receptors in your vomiting zone in the medulla oblongata. So that's why we see women having severe nausea, severe vomiting, cannot sleep, and hypersensitivity to light, sound, and all their senses. It's all due to these M1 receptors being triggered. So this patient here has a particularly rare symptom that we've never encountered before. She developed her hyperemesis with first a heartburn symptom. So when she first experienced this heartburn, we could not relate this to hyperemesis because heartburn is quite a common pregnancy symptom that we see, and it's not something that should be alarmed of because it's quite common that sometimes their digestive system have some issues because of the fluctuations of these pregnancy hormones that we see, and it usually goes away on its own. But this patient had sustained consistent heartburn over a week, and then followed by severe diarrhea as well. Concluded that this was related to hyperemesis when we realized that she started puking very soon after. Consistent puking, and also severe nausea, and also severe insomnia. So this is the first time that we've observed heartburn associated with hyperemesis, and we'd like to actually bring some form of awareness within patients who have a history of hyperemesis. She tried all sorts of medications that are related to heartburn, but it didn't subside because the core reason is not the digestive system, it's because of these M1 receptors being triggered. So very soon, that once she got diagnosed with us, we administered our HCG desensitizer to her, and her symptoms subsided substantially, where she can actually start eating again, she can actually sleep well again, and she's not overly reactive towards the environment. She's much more stable now. So in conclusion, hyperemesis is still a very poorly understood and a very complex pregnancy disorder that needs a lot of understanding, especially from our patients, where they come forth with all forms of different symptoms that we are still learning about. It is a severe pregnancy disorder that needs to be taken seriously, and here at Antai Hospital, we offer our HCG desensitizer to treat your hyperemesis. And if you'd like to seek treatment, please get in touch with us today. If you have any feedback, if you'd like to leave a comment for me, please visit the comment sections down below.